As the United States deals with over 10 million infections and more than 240,000 deaths, the nation's top infectious disease expert, Dr. Anthony Fauci, has warned on the dire state of the nation due to the blazing pandemic. In his latest statement, Dr. Fauci has said that the United States is in a very, very difficult situation with COVID-19.
We're in a very, very difficult situation. It's quite problematic. I have said that publicly many times, not to scare people, but to bring a reality check to where we are. If you look at it, we have 10 million infections in the United States, almost 250,000 deaths. We've had 60,000 hospitalizations. And now, last count, we had 143,000 infections in a single day.
Now, we are being joined by Professor Michelle Iniel, the computational biologist who is joining us live from Jerusalem in Israel. Thank you very much for being with us. Now, this is very encouraging news from Pfizer and BioNTech with their vaccine showing 90% effectiveness. Now, people around the world are hopeful that there is now a light at the end of this very dark corona tunnel. But in reality, how soon will people be receiving the vaccine?
Okay, of course, as you said correctly, the finding of Pfizer really make a change game in the, how we deal with the COVID-19. But of course, and I hope that everybody understand this, that this is not a magic in the sense that in a month or half a year, there will be a solution for the entire world. This is a very important step towards treating, and but I think by now, and definitely for the next few months, maybe a year from now, people need to build a strategy to live with the COVID-19 and not just to wait, passively to those very important ongoing vaccine effort. And I think this is the main message, that we need to do everything in our power to prevent spreading of the disease, and hopefully within, let's say, few months, but definitely not less than that, there will be starting a solution. And I hope that the first set of vaccines will be indeed going to the medical staff in order to make sure that we have enough capacity to treat the scale of the pandemic that we are facing.
Absolutely, Professor. Masks and social distancing. Now, we do know that the vaccine that comes from Pfizer and BioNTech needs to be stored at especially low temperatures. Now, this will certainly pose a challenge in terms of the logistics. How will this distribution happen on the scale that it needs to?
Yeah, so indeed, as we know, vaccine is a stepwise procedure. And Pfizer and other company, by the way, I'm sure that within the few months will come up with very good news, such as Moderna, maybe Oxford, Johnson & Johnson, and so on. There will be some more coming to the, to the line, but all those issues of logistics are as important, I would say. First, people need to know that they there must be a lot of explanation to make sure that people will be willing to get the vaccine, and to avoid all kind of stories about, people that are rejecting in general, irrespectively to COVID-19. I think this is very important. I think the storage, as you mentioned, is extremely important, and Pfizer themselves are building up a procedure in which their vaccine will be sent in those very extreme temperature, so that it can be delivered in packages directly to the countries within this very non-standard, I would say, delivery system. There are a lot of logistics on the way. I just heard that Pfizer themselves are trying to do a new formulation in which they can send it as a powder, and the activation of the vaccine will be done locally. That will be, again, very, very important step, but we are not there yet.
Right. And the US and the European Union are first in line for signing deals for the vaccine. We heard from Benjamin Netanyahu saying that he is working around the clock to get the vaccine in Israel, but we know that this vaccine will need to be distributed globally in order for it to be effective.
Yeah, so of course, there are two issues here. First of all, the local vaccination. I mean, it's clearly that if we indeed keep the borders closed, one can still deal with local vaccination of a country or a region and so on. That will be good enough. However, the hope is that the border will be open, and then, of course, people will travel from all around the world. Therefore, it's very important to deal with it in different resolution at the local, city-like, region-like, country-like. But this is one of the challenges of the world, to work globally so that it will be clear that we are not leaving behind a region or countries or even continent without the right treatment, because then we will never get rid of this. It's exactly like the big, a pandemic of, polio or other flu that are done in a global view rather than local. Without it, we do not have much possibility to open the border and make the world global again, as we used to have a year ago.
Professor, thank you very much for joining us and bringing us all that analysis there.
Yeah, my pleasure. Sure.